I'm Andrea Driver-Williams. I'm an adult nursing lecturer here at BCU in City South, and I'm here to debunk myths around HIV where I have a specialist interest. When HIV first came around, it was believed to be a gay man's disease. Back in the 80s, it generally affected that population. However, nowadays, anyone from any sexual orientation, any gender, any age, any race, any religion, anybody can get HIV. It does not discriminate. In 2022, the figures in England showed that those accessing care causes of exposure, but sex between men was approximately 42,000 and heterosexuals were approximately 44,000. HIV is when the virus first attacks the body. So this is where the virus goes into the cells and makes copies of itself and affects the body. If it's untreated and undiagnosed, it will then develop into AIDS. With today's treatment, there are far fewer people developing AIDS. This shows that the treatment's working. You can actually get HIV tested in a range of clinical and community settings. You can be tested in sexual health clinics. There are some clinics run by HIV charities who offer HIV testing. GPs, or some GPs, offer HIV testing as well. You can also get home kits. Here at City South, within the 5-mile radius, we have 10 clinics available to go and be tested at. It cannot be transmitted via sneezing, kissing, touching people, sharing food. It can only be passed on if somebody has a detectable viral load and through bodily fluids. So through vaginal fluids, anus mucus, breast milk, blood and semen. A condom is the most effective way of preventing HIV transmissions, and it will also protect you against other STIs. HIV is treatable. We put a patient on a medication called ART, and this reduces the virus level in the body until it becomes undetectable, and then it cannot be transmitted. If someone has an undetectable virus load, so they're on treatment and it's working, they cannot pass on the virus. So undetectable equals untransmittable, U equals U. PrEP is available and this can reduce your risk of acquiring the virus. If you're worried post-sexual intercourse about the possibility of HIV, please speak to your local sexual health clinic about PEP. This is a medication to help prevent HIV infecting the cells. Unless you've been tested for HIV, you have no way of knowing for certain that you have acquired HIV. HIV can be asymptomatic, so this means you'll have no symptoms for years and years and years, so therefore you could pass on the virus without realising it. Yes, you can be mistaken and think that other symptoms are for other illnesses, such as a raised temperature, chills, a headache. With early diagnosis and treatment, those on effective treatment can live long and healthy lives. Just like anyone else, they can have relationships, play sports, work, and have children. Pregnant women living with HIV and on effective treatment can have babies that are HIV negative, and they can also breastfeed these children as well. So the take-home message is to get tested. It doesn't matter who you sleep with or what kind of sexual intercourse you're into. Everyone needs to get tested to make sure they are HIV negative, and if they are HIV positive, we can get you on treatment and get you living that long and healthy life.